Hello, everyone, and welcome to our webinar on Greyhound diseases. I'm Mandy Albert, President and Executive Director of the Greyhound Health Initiative. Thank you so much for attending today's webinar. We really appreciate your support. Today, we're joined by Dr. Guillermo Couto, who will be guiding us through the unique health challenges commonly seen in greyhounds. Our goal is to shed light on the medical mysteries of these incredible dogs and provide the knowledge to both owners and veterinary professionals to ensure our greyhounds receive the best care possible. To help us minimize distractions and keep the session running smoothly, please keep your cameras off and your microphones muted throughout the webinar. Here's a quick look at today's agenda. If you have any questions during the presentation, please type them into the chat, and we'll address as many as we can at the Q&A session at the end with Dr. Couto. If you run into any Zoom-related issues, feel free to use the chat as well, and our volunteers will do their best to help you troubleshoot the problem. The session is being recorded. A link to the recording will be emailed to all the registered participants once it's ready. Please allow us up to 1 week to get the recording to you, and be sure to check your spam folder because sometimes they go into spam before you reach out to us. If you have any trouble or if you do not receive the recording, please email us at support@ghi.vet. For anyone who may be new to us, the Greyhound Health Initiative is a nonprofit dedicated to improving the health and well-being of sighthounds around the world. We work to raise awareness about their unique medical needs through education, outreach, and research, and today's webinar is one of the ways we do that. If you'd like to explore more of our educational resources, you can visit our website at ghi.vet and head to the Educational Resources page. You'll find a search bar and filters to help you quickly locate the topics you're interested in. We're always adding new content, so feel free to check back often. For the latest updates, be sure to follow us on Facebook, Instagram, LinkedIn, or YouTube. Now it is my pleasure to introduce to you Dr. Guillermo Couto. Dr. Couto is a board-certified veterinary oncologist and internist with an interest in hematology and sighthound medicine. He provides consultation through his company, Couto Vet Consultants, on veterinary and comparative oncology, hematology, and immunology, and clinical consultation on greyhound and sighthound medicine. He also delivers high-quality education for owners and veterinarians. Dr. Couto has worked with greyhounds and other sighthounds for over 3 decades. He's had an accomplished 30-year teaching career at The Ohio State University and is a pioneer and expert in greyhound and sighthound medicine. In 2004, Dr. Couto launched the OSU Greyhound Health and Wellness Program, creating an outreach and teaching effort that incorporated basic elements of shelter medicine. Once retiring from the oncology hematology service at the Veterinary Medical Center at OSU, he helped establish the Greyhound Health Initiative and the GHI Blood Bank. Since then, Dr. Couto has been actively involved and dedicated to improving the health of sighthounds through education and clinical research. Now I will pass it over to you, Dr. Couto.
All right. Thank you so much. So I'm going to replace your current share, and then hopefully we will have slides to show. Everybody sees the first slide? Mandy?
Yep.
Oh, cool. All right. Well, so great to quote unquote see everybody. As it happens, after we scheduled this webinar, we decided to take a little vacation. So we are vacationing, visiting our grandson and son and daughter-in-law. So early morning here in Vancouver. And let me tell you how this came about. You know, we've been talking about doing this diseases in greyhounds webinar for a long, long time with Mandy, and we finally set it together. And as I am putting all this together, I'm going, well, number one, the first challenge is how do you do a good job when you have both veterinarians and, you know, non-veterinarians in the audience? And I think that hopefully the approach I'm using will work for everybody. And second, inevitably, there is no way we can do this in only one, 50-minute session. So this is going to be part one of at least a two-part, probably even a three-part set of sessions. And we were discussing dates with Mandy. Quite likely we'll do the second part sometime in the summer. That is when I do a little bit less lecturing. So I usually use this slide facetiously because a lot of people reach out to Wikipedia first, and probably that is not the ideal scenario. But all of you know that greyhounds are sighthounds, and sighthounds are dogs that specialize in pursuing prey, keeping it inside, overpowering it, blah, 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 blah. All of you guys know all this stuff. And the interesting thing is that we know that they are archaeological digs where they have found sighthound looking dogs that go back to 7,000 BC. So, these dudes have been around for quite a long time. And in the process of doing that, they have adapted to what they do for a living, that is to run fast and chase things. And what I'm going to do is tell you a little bit about sighthounds. A lot of you have seen this video. Keep an eye on the lower left-hand side, and this is why they are called sighthounds. All right, don't let a bunny into a racetrack. So this is a race in Australia. And all of you who are sighthound owners or sighthound adopters or sighthound veterinarians know that these guys are like a totally unique breed of dogs. And a lot of you know when I adopted my first Greyhound a long, long time ago, that was Clyde. The first time I did a physical and I did lab work, I went like, what is this? This is not like any of the dogs I've ever seen. So the deal is that I spent 30 years trying to figure out uh, how are greyhounds different from other dogs? And again, as you will see, we looked at AKC greyhounds, we look at galgos, and we look at a bunch of other breeds. But what we discover is that yes, they're very, very different. So then the last 10 years at Ohio State, we spent trying to figure out, why are they different and what are the mechanisms behind these differences. And we had to get into molecular genetics and a number of other things. So Sarah Saldivar, that you see here in the middle, and this is Lily Marin, describes a greyhound as a long-nosed, three-legged dog with diarrhea and separation anxiety. And I think that, if you go to a veterinary hospital that does a lot of greyhound medicine, unfortunately, you see a lot of greyhound osteosarcomas, and the three-legged dog comes from there. But, funny enough, a lot of you can sympathize with this definition. So, lots of different sighthounds, as we mentioned before, and most of the work that we did at OSU, and I know Christina is online, and Christina was vital in running this program. And I saw that Bill Feeman is here. Bill started working with us with the Greyhounds when he was a sophomore veterinary student, and he continues to do a lot of stuff with Greyhounds in his practice in Medina, Ohio. So we work a lot with retired racing greyhounds, primarily out of the Wheeling racetrack. And one day I showed this photo to one of the students, and this happened to be two greyhounds that are running side by side in the first turn in the Wheeling racetrack. And the student said, this is the ideal greyhound because he has 8 legs and 2 tails. So if you actually happen to have osteosarcoma, you can actually keep going here and you will be in good shape. But again, the deal is these guys are very unique. And believe it or not, they are quite different from the AKC greyhounds. And even though these dogs phenotypically look very, very similar, they are actually quite different. I'm going to show you some genetic data that supports this stuff. A lot of people, if they are not knowledgeable, sighthound aficionados, they will not be able to tell apart an AKC greyhound from a retired racer. And as you will see, like I said before, genetically, they are quite different. And then, because I spent a long, long time at Scooby Medina in Spain, bringing Ohio State veterinary students to help do shelter medicine at Scooby and do spay and neuter clinics and a number of other things that, went from a 1 trip a year with 3 students to 4 trips a year, where we would actually have anywhere between 50 and 60 people working on galgos in the shelter for the whole week. And we learn a lot. We provided a really cool service, and we help a lot of dogs. And look at these beautiful dogs out here. So all of you know that galgos are used for hunting primarily, and if you think about a greyhound as a sprinter. The galgos are more of a marathon runner. They have to sprint at the end, but they are more of marathon runners. So if you see that my face has turned a little bit red, I am actually in my son's office in his house, and he has a light for the plants that has a red bulb, and it just came on. So I am not going to get out of here to unplug it. So it's not that I'm blushing. It's just I'm going to grow a little faster for the rest of the day. So the deal again, three seemingly similar animals that, as you will see, are quite different. So I was telling you about genetics. We did a lot of work with both Children's Hospital and Elena Strander's group, and a lot of the genetic centers in the Boston area looking at primarily bone cancer. But one of the byproducts of that is, in one of the studies, the one that I just showed you before from Elaine's group, we were doing GWAS or genome-wide analysis to look at genetic components in different diseases, primarily bone cancer and greyhounds. And what we found is that the retired racing greyhounds and the AKC greyhounds segregate literally as two separate breeds. If I show you one with all the breeds, the Rottweilers will be somewhere around here. So they are like very different, even though phenotypically they look quite similar. And a lot of you guys know that in the 50s and 60s, some show dogs were racing and some racing dogs were being showed. So there's a little bit of cross-pollination. So let me tell you how this started. I go, well, you know what? I need to learn more about greyhounds. And if I need to learn more about greyhounds, I need money. And how do I get money? Well, we can get donations, but we also need to write grants. And if we need to write grants, we need to have preliminary data. So what we decided to do a long time ago, so this is probably late 2005, early 2006, is we did a web-based survey with, Lily and Christina and Linda Lord and Jill. Linda was one of the epidemiologists at Ohio State. And we surveyed Greyhound owners, and we sent out 747 surveys, and we collected a lot of information that we eventually published in the Journal of Veterinary Internal Medicine, as you see here. And, until then, most every publication on greyhounds was about orthopedic issues. There was very, very little internal medicine. And, being an internist and, of course, being an oncologist, I really needed to get this information. So after we did that, we subsequently did one for AKC greyhounds, and then we did a different one for galgos. So what I wanted to show you now in the next 4 slides or 5 slides is the fact that these dogs look very, very similar, like we said before, yet they have totally different diseases. So the only thing I want for you to pay attention to in this graph, so we have AKC dogs here on the left, we have the racers in the middle, and we have the galgos in the right-hand side. So these are the prevalence of different types of diseases, and you have skeletal and cancer and osteo in particular, skin, allergies, dental, blah, blah, blah. All I want for you to see here is how different the height of these bars is. Nobody's surprised that dental is a big issue and that a lot of them have diarrhea and so on and so forth. But the truth of the matter is that to me, the most shocking piece of information was how different AKC greyhounds are from the retired racers, and we'll touch a little bit more on that. So again, if you keep looking at all the different things that we asked for, totally different heights for these bars. And again, remember, what is the caveat of this study? That this study was answered by the owners or adopters of this dog. So perhaps we didn't have all the medical information as detailed as we would like to, but we validated this by selecting a small group of dogs in each survey and then contacting their veterinarians and confirming that what the owners were telling us is exactly what was going on with this dog. So for the AKC dogs, as you can see, these bars are relatively low. There's some dental issues, some osteoarthritis and things like that. Very, very low prevalence of cancer. We're going to talk a little bit more about that. And again, just to show you, in contrast with racers, again, no surprise about the teeth, but some skeletal issues. This bar on cancer is a little bit higher. And again, what I'm showing you here is what proportion of dogs in these studies had developed cancer during their lifetime. So that is the height of this bar. So it will be about 18%. So 1 in 5 or 1 in 5.5, something like that. And again, same deal for the galgos and, bad teeth and, some skin issues and a number of other things. So this is just the only goal of these three slides, you guys, or four slides, is to show you how different the prevalence of different diseases are. And, quite often I get an email with the consult, what are the common diseases in sighthounds? And then in internal medicine, to me, every single answer to a question starts with it depends, and what does it depend the most on? Primarily, what breed of dog are you dealing with and where are they coming from? But this is what I want for you to see. This is actually causes of death in the three breeds. And what you can see is cancer is the first bar in light blue. And what you see in green here in the AKC, that is a really, really tall bar, is other. And interestingly enough, for the AKC dogs, the other was primarily behavioral issues, aggression and a number of other things. But look at how different the prevalence of death from cancer is in these three breeds. And it's rather obvious that in retired racing greyhounds, literally 2 out of 3 die of cancer. And remember, about 50% of the deaths in greyhounds are from osteosarcoma in retired racing greyhounds. I have to tell you that in my 30 plus years, or almost 40 something years now, of dealing with sighthounds, I have actually seen only a couple of AKC greyhounds with osteosarcoma, and none of them were in the typical bones where we see osteosarcoma in retired racers. So again, totally different breed, totally different sets of predisposing facts. And remember, when we talk about cancer, even though it is a multifactorial disease, it's primarily a genetic disease, and we'll talk a bit about that as we go along. So I started making a list of what are the common diseases I really want to chat about, and there's a lot of different things, and people email me about this all the time. So what I decided is for now, I'm just going to talk about bleeding and clotting. Primarily, that's going to be the thrust of this lecture, with a little bit on infectious diseases. If we have time, I put in a few slides about high blood potassium during anesthesia. That actually is something that kills a sizable number of greyhounds when people are not aware of it. And then I'm going to leave the rest for the next sessions, including probably a whole session on osteo. And I figure I have to put leishmaniasis in there for those of you who don't know what that is. That is a very common disease in galgos in Spain. It actually in dogs in Spain, regardless. But this year I did, I want to say 16 or 17 consults of galgos with leishmaniasis. And most vets in the US have never seen a dog with leishmaniasis and had never learned about leishmaniasis. So I think it's worth putting a few slides together to educate you. So I started by which diseases have given me the most headaches when I was dealing with greyhounds on the clinic every day. And I think that bleeding was the big, big issue. And I'm going to give you a little bit of the history of how we got to our destination. But we all have heard, 30, 40 years ago that a lot of greyhounds bleed after surgery or trauma. And the frustration was, we do clotting tests and they're all normal, their platelets are fine, their clotting times are fine, everything is good. So we think is what we call disseminated intravascular coagulation, or DIC. That is a very common end stage of a number of different diseases. But, the few dogs that we had seen, we know they did not have DIC. And for those of you who are not familiar with this disseminated intravascular coagulation, the acronym DIC quite often is used for death is coming, all right? So it's a very serious condition that kills a lot of patients. So the deal is that these patients quite often require plasma transfusions, blood transfusions, and a lot of them actually died from bleeding in light of absolutely normal tests of clotting, which to somebody who is interested in blood coagulation, as I am, was really, really puzzling, and we had to do a lot of work to figure it out. But the flip side of this is that a lot of these greyhounds, as opposed to bleeding, they clot excessively. They throw a clot to the brain or to the spinal cord, or they have a clot in the aorta that is feeding blood to the rear leg. So we had a little bit of work to do. So So if you look at the coagulation system or hemostatic system, it's like a balance, right? If you tip in one direction, you bleed, as you see here. If you tip in the other direction, you clot, all right? So your arms have to be perfectly horizontal all the time. And it's just a miracle that we don't bleed to death when we're shaving or we don't throw a clot when we're sitting in a chair for more than an hour. So the way this works for the non-veterinarians is clotting or coagulation or the hemostatic system is super, super complex. There's a lot of positive feedback, negative feedback mechanisms, and the like. But if you assume, let's say that this is a blood vessel and we're going to collect blood from your dog to do some testing, when you put the needle, the blood will start coming out right the minute you pull the needle out. So these little cells that circulate in the blood that are called platelets, they actually get attracted to the site of the lesion because there are proteins that suck them right in. And this platelet will form this tiny little plug in there that is what we call primary hemostatic plug that will actually last from a few seconds to a minute or a minute and a half, something like that. At the same time that these platelets are aggregating, they are actually creating this protein that is called fibrin. So there's a lot of different mechanisms that will come together to make fibrin. And fibrin, when you look at, if you get a cut and you get a crust, most of what you see in the crust is fibrin. So it's this protein that actually solidifies and plugs the hole permanently. And that is called a secondary hemostatic plug. The analogy I always use is the primary hemostasis is, let's say you go in the kitchen and you have a leaky pipe and you stick your finger in just to stop the water from coming out. That's your primary hemostatic system. So in the meantime, somebody in the family calls a plumber and the plumber comes over and, they fix this for good. And that's the secondary hemostatic system. If you think about it, that is great because it keeps you from bleeding out. But what would happen if this clot keeps growing and growing and growing? Well, what will happen is it will occlude the lumen of that blood vessel, so you will not have any blood going through. So you will have a thrombus. So anytime you have a pro-coagulating or pro-clotting mechanism, you have to have anti-coagulating mechanisms. And the big one is what we call fibrinolysis. So the fibrinolysis is kind of like a Pac-Man. It just goes and chews up the clot. I'm going to show you a little video here in a minute so you can see what I'm talking about with a little bit more detail. But this fibrinolytic system is what will allow for blood to continue to flow through that particular injured vessel. So again, very, very basic hemostasis. So now you're going to see the biggest needle that you've seen in your life, and it's going to come over from the top, and it's going to make a hole in there. And as the needle comes out, the platelets will come over and will start plugging that little hole. So that's that primary hemostatic plug. And at the same time, they will start activating fibrin formation and they form that little clot. But if it gets too big, we're in trouble. So here comes the Pac-Man and it just chews it up and it levels it. And eventually what will happen is the cells that line the vessels will then be able to grow and close the defect and no damage is done. So think about it. We have trillions of endothelial cells that die every day and we don't bleed to death as a general rule. So again, this is kind of like the way the hemostatic system works. So all the cases when you're a clinician start with an index patient, and I had two. Elga was one. This is a case that Linda Perko had sent to be spayed. She had a totally uneventful spay, and Linda calls me and she goes, she's bleeding a lot. They put a compressive bandage and she's bleeding through the bandage. By the way, you guys, quick announcement. I'm going to show a lot of pictures of bloody stuff. So if you're squeamish, cover your eyes, starting with the next slide. But Elga comes from a 2.5 hour drive. They had just put this compressive bandage in her belly, and the bandage is soaked through and through. And then when we remove the bandage, not only does she have a big bruise where she was spayed, but she also has a belly full of blood. So again, she had to go back to surgery. There is nothing wrong inside, no loose ligatures or sutures or anything like that. And all her clotting tests were normal. So this is when we start getting really interested on what is actually going on here. And my second index patient, and I'm sure Christina is smiling when she sees Alicia, but Alicia had this really nasty tumor in her shoulder. There was what we call a histiocytic sarcoma, and mom had been told that there was nothing they could do about her because she was old. And, we saw her on the 23rd of December, I remember, and she was extremely painful. So there was no other way of getting rid of the pain other than doing an amputation. And it was either that or euthanasia. So Joe decided we go for surgery. So we did the surgery on the 23rd. She went home on the 25th, and Joe calls me on the 26th because she found blood around the house. And you can tell that her foot, her whole leg is really, really swollen. And you can see that there is bruising inside her leg. And this is all blood that is actually dropping by gravity, and the blood that Joe is seeing is coming in between her toes, in the three legs, and we're going like, what is going on here? So basically, all the clotting tests are normal. So that's when we decided, we need to invest a little bit of time, and we invested, I can't remember, maybe like 15 years and maybe close to $500,000 trying to figure out exactly why they bleed and what we can do about it. And this is your ultimate nightmare, right? You take your dog to be microchipped, and this is the end result. I mean, you need to transfuse them. They have to go to ICU. So this was like an $8,000 microchipping extravaganza type of thing. And if you look at Peanut, you cannot even tell it's a Greyhound, from how swollen all this is. So we decided that we needed to do a little bit of a survey, and we surveyed a lot of veterinarians, and most vets said, yeah, when we do big surgeries, these greyhounds bleed, but we don't know why. So we did this study with Anna Lara, who was one of my residents and grad students, and Marjorie Brooks is probably the world leading hemostasis expert in dogs, and she's at Cornell. She's another internist and great person with a fantastic lab. So we had a very good hemostasis lab at OSU, but the few tests we could not run, we sent them to Marjorie. So we basically tested all these dogs that we spayed or neutered. So a lot of we used to have a free spay and neuter clinic for greyhounds at OSU for a number of years, and they were primarily Linda Perkos dogs from Greyhound Adoption of Ohio. So in this study, we look at 88 dogs, and prospectively, we created a bleeding score so we could, give it a number based on the extent of the bleeding and so on and so forth. And at the time, so this is in 2008, we did every single test of clotting that you could actually do in a dog. So we did all that stuff to try to figure out what was going on. So these are not like routine tests. So these are fancy research tests, very expensive. This was, I can't remember, maybe like $800 or $900 per dog, give or take, of tests at the time. So this is a grade 3 bleeding, from a bruising, all around the surgical side. And, we look at all these dogs and there weren't any radical difference. What were we looking for? Obviously, a test that we can do before the surgery and we could predict whether this patient would bleed or not. We also looked retrospectively at amputations, and with the data we had at the time, we figured that about 26%, one in four dogs that were spayed or neutered bled, and actually 37% of those who underwent amputation. Oh, I have to tell you that I think 100% of these amputations were for cancer, so they were not for trauma. But again, a fairly high prevalence of bleeding. We're going to go back to these numbers again in a little bit. So 26% for the spay and neuter and 37 for the amputation. So we propose that based on the data that we have, even though the data were not statistically significant at the time, we assumed that if we had done 200 dogs instead of 88, probably they would have been. But what we thought was going on is that these guys had enhanced fibrinolysis, that clot busting system, that Pac-Man that was chewing the clot. Why? Because they start bleeding 36 to 48 hours after the surgery. Usually, as most of you know, when you do surgery on one of these guys, they wake up, everything is good, all right? But then a day and a half later is when they start bleeding. And then, I started thinking, all of you guys know that the greyhounds have really thick blood, and when they race, they shoot out of the gate, and their spleen that is huge shoots a big bolus of blood into circulation. So their blood is very, very viscous, very, very thick. And thick blood clots. All right. So I suspect that over those 7, 8, 9,000, 10,000 years, sighthounds evolved to have a hyperactive clot busting system, because if not, they couldn't run. Their blood would clot. So they had to have a mechanism to protect that sludging blood from clotting and basically killing them. So I think that this is evolution at its best. And again, we proposed that. We didn't have a ton of data. And again, a lot of you have seen, post amputations. Here's Miss Nelly, and this is Montana. I can show you hundreds of pictures. So the situation was as follows. One night is like, I can remember 11:30 or midnight, and I'm in ICU. I'm on transfusion number 5, I think, of my patients, and there is this drug that a lot of you heard about that is called epsilon aminocaproic acid, and I'll talk about this again in the next couple of slides. And I used to use this in Argentina all the time when I had a bleeding dog, and in theory, the main mechanism is that it inhibits the clot busting system. So my patient is in deep trouble, and I go, you know what? I'm just going to give her Amicard and see what happens. So I give her, intravenous aminocaproic acid, and within 2 hours, she stops bleeding. And I go, well, maybe it was just going to happen if I gave her, Pepsi or Coca-Cola, or she was going to stop all the same. But then on the second dog, when after amputation, this other dog started bleeding, I started them on Amicard right away and they stopped. And I said, well, this is interesting. So we need to actually look at this in some detail. So then we did this prospective study where we spayed and neutered a bunch of greyhounds, and we randomized them, basically flipped the coin, do they get Amicard or they get a placebo? We had the pharmacy prepare placebo capsules that look exactly like the Amicard capsules, and we were blinded to the effects. And then we would give them this drug for 5 days, starting the day that they had the surgery. It was partially funded by the Morris Animal Foundation. So there was a big study, a very expensive study. I can't remember, $250,000, something like that. So we ended up getting quite a bit of data. And this is what we showed. What we showed is that if they were getting a placebo, 30% of the dogs bled. If they were getting the aminocaproic acid, only 10% of the dogs bled. So we felt very, very confident that this was the way to go. And, I was doing a consult yesterday on a greyhound that is going to undergo surgery for a small tumor in the base of the tail. For me, any surgery in a greyhound, what I would call big surgery, cancer surgery or going in the abdomen or thorax, state of the art is you must give them aminocaproic acid or tranexamic acid, as I will show you in a minute. So fast forward to a few years ago, Michael Court, who is an internist at Washington State, we started talking about the bleeding, and Michael does a lot of really high quality genetic work. And we connected, chatted about a number of different projects, and he was very interested in the wolfhounds because we had a colleague that works with wolfhounds, and he Michael contacted me. So we were trying to figure out exactly how to go about it, because as a lot of you know, wolfhounds and deerhounds actually bleed. And Michael looked at both deerhounds at the beginning and then wolfhounds. And I'm going to show you first the deerhound data and then the wolfhound information. So what he did is he did, gene sequencing. So he was trying to figure out, okay, in these deerhounds that bleed, do we find any genetic mutations that could explain why they were bleeding? And what did he focus on? He focused on the fibrinolytic system, the clot busting system. And what he found is that this SERPINF2 gene that encodes for what we call alpha-2 antiplasmin, this antiplasmin is the one that inhibits fibrinolysis. So if you basically do not restrain that fibrinolytic system, it works over time. And this explains perfectly well why they have enhanced fibrinolysis. That gene is in chromosome 9, and then he developed this test that he called the DPO gene. I like his term, delayed postoperative hemorrhage is a lot more professional than delayed postoperative bleeding, as we used to call it. Besides, DPOB doesn't quite sound right? So now, you can submit samples to his lab for testing, and this test was validated for deerhounds, and I'll show you the data on some of the other breeds, even though it has not yet been completely validated in the other breeds. We have some preliminary data. So again, that confirmed our suspicion that the more likely scenario was that their fibrinolytic system was just chewing up the clot. So this is a study that just came out actually a few months ago. So he looked at a wolfhound that was bleeding severely, and then I'll show you this magnified here. So he looked at a lot of different dog breeds, as you can see here. And what he found is that out of 649 greyhounds, 29 had that gene mutation. For the wolfhounds, 24% had it. For the Basenjis, 23%. The Basenjis to me were kind of unexpected because I haven't seen any bleeding Basenjis. But as you can see, even going down to whippets, 1 in 10 or 1 in 12 did have that gene mutation. So the deal is we now have a very concrete explanation as to what this story with this bleeding is. Interestingly enough, you can see that there are a lot of sighthounds here in the bottom that did not have the gene mutation. So can you do a blood test for depot gene and determine whether your dog is going to bleed or not? Apparently, that works in the deerhound. That has not yet been validated in the greyhound, as far as I know. The last time I talked to Michael was a few months ago. So we did a lot of stuff with aminocaproic acid, and to be honest, if we did some pretty cool research when I was at OSU, but I think that if you look at what did we do that saved the most sighthound lives is the aminocaproic acid situation. So I think that that radically changed the outcome. The cost of surgeries, a lot of these greyhounds were hospitalized for weeks after the amputation because they kept bleeding and rebleeding and so on and so forth. So if you are in Europe or if you're in Canada where it's difficult to get epsilon aminocaproic acid or Amicar, tranexamic acid is widely available. They are relatively inexpensive and they are equally effective. I do not have data to show you on tranexamic acid, but I've consulted with vets that have treated plenty of sighthounds with tranexamic acid and they have done well. So there's anecdotal evidence that Yunnan Biao, that is a Chinese herbal drug, may be effective, but I do not have any data to show you. So we're done with the bleeding. Now we're going to talk about the exact opposite, clotting. So I put strokes. I was going to put, thrombosis, but stroke sounds a little bit more ominous. But most of what we see happen to be strokes, So if you read the old internal medicine books from 30 years ago, they would tell you dogs do not get strokes. And then my reply to that is, well, greyhounds are not really dogs. They just kind of look like dogs. But we do see these greyhounds, they have acute or peracute. Peracute means you're walking your dog and your dog actually has this acute neurologic signs. It can be in the brain or the spinal cord. We see also clots in the arteries that feed the rear legs, what we call aortoiliac thrombosis or aortic thrombosis, whichever term you prefer. And if they have strokes, primarily they are disoriented, they have a head tilt, they stagger, they are weak, they cannot stand, they thrash, they have seizures, etc., etc. And that happens like this, at the drop of a hat. In the racetrack, it's very, very common for greyhounds to shoot out of a gate, and in the first straight, they fall down and they cannot walk. And they used to say, well, they have these fibrocartilaginous emboli that nobody really knows what the heck they are. But when we MRI'd and CT scanned a lot of these dogs, they actually have clots in the spinal cord. And I'm going to show you some pictures here in a second. And the other presentation of clots in greyhounds is chronic rear leg lameness. You have a slowly forming clot in the artery that feeds the rear legs, and that likely causes the legs to go to sleep, and that's why they are lame. And these dogs, of course, get radiographed and everything looks good. So this is something that you need to be aware of because it's, again, easy to diagnose and treatable. So if you have a stroke or acute neurologic signs, dogs are like people. The sooner you do it, the better, right? So you don't want to mess around with this. You want to start acting on them as quickly as possible. So Christina is probably going to shed a couple of tears because this was her baby, and Free had had a limb amputation, as you can see. And in the middle of the night, she develops this acute neurologic signs where she cannot stand and she's thrashing around and this and that. And this is an MRI of her brain. And all this white stuff that you see here is actually dead brain tissue from a big clot. So, we treated her aggressively with anticoagulants and this and that, and she did fairly well. And this happens to be Zoo's 18-month-old dog, 18-month-old dog that is walking with mom, and then he just falls down, cannot get up. His legs are not working. And in this CT with contrast, you can see this is a big clot in what we call the venous sinus of the vertebral area. And again, this thing went from literally a little bit behind his shoulders all the way to the lower back. So it was like a snake this long. So again, he was treated with anticoagulants and did really well. This happens to be Macy. Macy was a greyhound that had chronic progressive intermittent lameness in one rear leg that then progressed progressed to the other one. This is an ultrasound of the aorta. Black is the way a normal aorta should look like. This is blood flow towards and away from the scanner. And this whole, gray white thing you see there is a big clot that went from kind of like the lower back almost all the way to the knee in one of the legs. So, really, really, really long clot. So again, these clots are chronic. So as opposed to the ones in the brain that are acute. So here's the biggest issue. In veterinary medicine, more often than not, if your dog has neurologic symptoms and ends up in the ER, the first thing that they are going to give him are corticosteroids, prednisone, dexamethasone, prednisolone, something like that. Corticosteroids enhance blood clotting. So the last thing you want for your dog to get if they have a stroke immediately after a stroke is to give them steroids. So what do we use? We use aspirin. We use mini dose aspirin. So usually like a quarter of an 81 meg tablet once a day works for most dogs. And again, no corticosteroids, which is very difficult because you're freaking out. You're in the ER with your dog, and your vets are telling you, well, we're going to put a catheter and give him steroids. And you have to go, no, 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 no. Just hold off. Let's try to figure it out before you give them steroids. So most dogs will recover completely, and they will have a normal lifespan if nothing else develops. So again, just to give you a little bit of a, how can the scale tilt in one direction and then tilt the other one. There's quite a few papers in the last few years looking at strokes in sighthounds, and this is not just a greyhound thing. We see it in galgos, we see it in a lot of other sighthound breeds. And why do they do that? Probably because they have really viscous or thick blood. So, all right. So hopefully everybody is hanging in there. We have like a few more minutes, and we're going to talk about tick-borne diseases or vector-borne diseases. So this is a dog at Scooby. And again, these are, some of the ticks that we see in greyhounds in the US is a lot of the prevalence of ticks is different in different parts of the country and in different parts of the world. So, I'm going to give you just like a general view of what this story is. Again, more pictures of your favorite bug. And this, I think, is a really good one. You ticks give the rest of us parasites a bad name. All right. So again, ticks are an issue, with global warming. Ticks are moving literally all over the place. We used to see these diseases in the southeast in the US. Now they are basically all over the US. In addition to that, with all the travel that is going on, we're importing ticks that we had never had in the US. There is a tick that came from Korea a number of years ago that is called Asian longhorn tick. And it came in sheep that arrived in New Jersey in 2017. And the ticks were, quote unquote, completely contained. Fast forward to now, they are in 18 different states, and they carry some of the bugs that I'm going to tell you about, plus a few more that we have never seen in this country. And yes, they can transmit this to dogs and to cats because there are papers from Korea describing these diseases in dogs and cats. So in other words, hang on to your hats because there's stuff coming. These, you guys, are some. They are not all. If you want to see all the tick-borne diseases in the planet, you can go to the CDC webpage that has all of them listed. But Lots of different Ehrlichias, lots of different Babishas. There's a lot of Borrelias. I'm just listing only the one there. There's 34 species of Bartonella now. There is a lot of species of Anaplasma, lots of different things. So people tend to think, well, I don't really care what my dog has, but if it is a tick-borne disease, I'm going to give him doxycycline. That is a version of the original tetracycline. But what is the funny thing? Doxy does not kill all the organisms. It just kills some of them, the ones that you're seeing there in green. So that's an issue. Treating a dog that is generically infected with a vector-borne disease with doxy is hit or miss. And the other thing that I think is probably one of the most important take-home points from today, don't forget that a lot of them can get to you, right? So we know that you're not going to get them from your dog. You're going to get them from the ticks that bit your dog. And there's a lot of ehrlichiosis in people. There is a couple of new species of Babesia in people, primarily the new species of Babesia. In the paper that just came out, of 7 people, 5 were veterinarians or animal care providers. And again, all of people get Lyme, and Bartonella is a big, big issue in people. I'll tell you about that in another slide. So the important thing is that your dog is not going to give you this disease, but if your dog was bitten by a tick that carried this, and any other tick in the neighborhood that has this organism bites you, you can get sick. There is now dozens of papers of households where the dogs and the family have this infection. So you have to be aware of that. And in people, the most common symptoms are flu-like symptoms and neurologic disease, any type of neurocognitive disorder. But remember this, there is what I call the Ehrlichia I don't know I and the Babesia what's your name I, all right? So these are bugs that still don't have a name, and consequently, we don't have a test for them. So we know that a lot of these dogs and a lot of people infected have new species. Ed Breichert, who is a colleague and friend at NC State, Ed is the guru of these diseases, and if you do a literature search with Dr. Breichert's name, you're going to find hundreds of articles about all these emerging diseases in both people and dogs. So the deal is they can be an issue. The reality is that most of the time they're not. So in the sighthound world, they seemingly cause everything: both eyes, corners, cancer, seborrhea, racing injuries, vehicular accidents. Dog gets hit by a car, you test them, was Ehrlichia positive? Oh, maybe he decided to kill himself because it was Ehrlichia positive. But the truth of the matter is that in the old days, 50 years ago or 40 years ago, there was a very high prevalence of tick-borne diseases, and that has gone down radically. So I'm going to show you some data. So if they develop symptoms, blood diseases are the most common, anemia, thrombocytopenia, low platelets, neutropenia, low neutrophils or white cells, weight loss, fever, bleeding, lumps and bumps because the lymph nodes get big or they get inflammatory lesions under the skin. So those are the common ones. But again, as you will see, the prevalence in our neck of the woods is relatively low. So how do we test for this in the last, 5 minutes? So we can look for antibodies. So, when a bug infects us, our immune system will make antibodies. I'll show you another slide here in a second. It will take 2 to 3 weeks for the body to make enough antibodies that will be able to be detected in the blood. We used to use this test that is called IFA, immunofluorescence antibody. Now, most everybody uses the SNAP technology. That is a very rapid assay that in minutes in the office will tell you whether your dog is positive or not. So remember, this test will tell you your dog has antibodies against this bug. Now, what is the catch? For example, we know that in dogs infected with Ehrlichia canis, you treat them, they are perfectly fine. You test them for antibodies 2 years later, they still have antibodies. So a positive test does not tell you that the dog necessarily has the disease, only that your dog was exposed to that organism at a period of time yet to be determined. Whereas if you look for the bug, PCR looks at genetic material of the organism. So, if the bug is in the blood or releasing little pieces of the bug into the blood, that PCR test is usually positive. And this is how it works, So if a dog gets infected here, within the first few days, if you do PCR, is going to be positive, and then the organism is going to be decreasing in numbers in circulation because the antibodies are going to start killing it. So, but if you look at the early stages of infection, if you do an antibody test, it's going to be negative because the dog did not yet have an opportunity for the immune system to make enough antibodies that will be detected. So a positive PCR test is diagnostic. A negative PCR test tells you I did not have enough DNA or RNA from this bug in this sample that I got. So could it be that the dog was not infected, or could it be that it was an infection, but it was not actively shedding organisms at the time? So in endemic areas where we have a high prevalence, we do both usually to get a good idea. So how common are these diseases in greyhounds? So let me tell you a short story. So a few years ago, there was a lab in Arizona that was running all these tests, and you know, two adoption groups, one from Cincinnati, one from Cleveland, sent me their spreadsheets, and 52% of their greyhounds that were off the racetrack were positive. And I went like, that is so bizarre because for us, less than 2% of the dogs are positive. So then I contacted a third lab, and in this lab, they had about 1% of positive dogs. So then we started looking at these dogs, and what we found is that most of them were positive on IFA or antibodies for Babesia canis at low titers. And we had the opportunity to resample quite a few of those dogs, which all of them were negative. So I suspect that for that particular lab, they have a high prevalence of false positives. So in other words, the dog tests positive, but in actuality, the dog never saw the bug. What is the challenge? The challenge is that most of the labs use their IFA tests. So you will still get a lot of those that are positive for Babesia on the antibody test, but you can never find Babesia in the blood with a microscope or by doing PCR. So, a few years ago, this is back 2012, we did this study with IDEXX where we look at the prevalence of Ehrlichia in the US. We look at almost 9,000 dogs, and 0.2% were positive for Ehrlichia. So these were both sick and healthy dogs. So 0.2, all right. Then we look at Ehrlichia canis, 2.8, and most of them were in defined geographic areas. And then we look at Ewingii, that is another one. The Shaffiensis and the Ewingii are the ones that can infect people. Same distribution. These are Ixodes ticks. And again, we generated this paper that was, diffused quite widely. And then, IDEXX decided to do another study, and this study is a little bit bigger because they looked at 144 million samples, all right? And they look at all the different organisms. I'm just going to show you only a couple, but this is the distribution. 2.9% were positive for one of the three species of Ehrlichia. So that is a little bit higher than in the previous study, but they look at all throughout the country as opposed to only the east side of the country. And B, their new test is a lot more sensitive than the old one from 2012. And then same deal, anaplasma about 3%. So, very, very, very low prevalence. And if you go to places like the Caribbean, look at in Panama, 55% of the dogs are positive for Ehrlichia. So, is a very, very different situation depending upon where you are. And this is a nice paper from my good friends, Cindy Crawford and Julie Levi, where they looked at greyhounds and, heartworm, 0.2%, Ehrlichia canis, 0.4%, Borrelia, 0%. All right. And these are dogs in Florida, 1,500 dogs in total. So again, it looks like 1% is significantly closer to the truth than, 52%. So, in the Wheeling racetrack, we tested hundreds of dogs. Less than 0.5% were positive. Why? Because there's now much better tick control. I do not treat test results as a clinician. I treat patients. So a dog with a positive test doesn't mean anything to me other than the fact that the dog has been exposed to the organism, and I need to do a little bit more work. I need to do a blood count, a blood chemistry, a urine analysis, et cetera, et cetera. So I do not use, empirical antibiotic treatment unless there are extenuating circumstances. So again, then you need to figure out which drug or drugs are you going to use? And dogs is good for the common diseases. Imitocarb is good for Ehrlichia or for Babesia canis, and then we need other specific drugs. And the new bug, this Bartonella that I was telling you, this is a nightmare because it's extremely, extremely difficult to diagnose. They can have any symptom, they can have any changes in the lab work. Azithromycin is an antibiotic that works, but guess what? The CDC, Center for Disease Control, is discouraging veterinarians from using it because now they are starting to see azithromycin resistant infections in people that coexist with dogs that were treated with azithromycin. So a really tricky disease to deal with. And there's every time you open a journal, there's a new paper on Bartonellosis in dogs, cats, or people. So I think I'm going to stop right there because it's 9 o'clock, and then I'm going to leave the hyperkalemia for the next session because it's only a few slides in, and I'm going to stop my sharing for the time being. And the goal again was to give you a bird's eye view of some of the diseases that I commonly get consults on. So I think I'm going to stop there. Interestingly enough, I'm looking at the chat box here and it says that we have 99 plus comments. So I'm sure that we will have some cool questions. First disclaimer is a lot of times you're going to ask me a question about your dog, your own dog, past or present. And quite often I will not be able to answer it unless I have medical records or lab results or something along those lines. So I think with that, I'm going to hit the pause button and I'm going to get Trina to help with the question.
Want to share a screen while I do this? Yes. All right, so I've been collecting those questions and I'll read them out. And like you said, if there's one that you need more information, we can just have that person email you. All right, the first one was actually a couple people asked this. Have you seen enough Irish Greyhounds to see if their medical idiosyncrasies differ from American bred Greyhounds? And then also as a follow-up, when we import Australian retired racers, are there any diseases or circumstances I should be aware of?
Yeah, good. Yeah, so for the first part of the question, yeah, I've seen quite a few Irish Greyhounds, and the diseases seem to be fairly similar to what we have seen. We also looked at a bunch of UK Greyhounds several years ago with the folks at Cambridge, and we never published that, by the way. But I think that they have very, very similar diseases. For the Australian Greyhounds, I am not aware of any infectious diseases in Australia that we need to be worried about, like, the leishmania for the galgos. And until just a few years ago, there were literally no tick-borne diseases in Australia. Now, of course, there are, and they're all over the world, as a matter of fact. But the truth of the matter is that I don't know of any specific diseases to worry about. We do have, I know that Bill Feeman participates on this on and off, but we have a chat group, a listserv for UK and Australian vets, and there's quite a few American vets. So we're always talking about different diseases, and what they see seems to be pretty much what we see here. So I don't think that there is much difference there.
Okay. The next, I entered my 2 corn-free Greyhounds into the International Corn Study. I have a third with corns. I'm interested in an update on that project.
I tell you, I don't have any to give you. Trina will probably know more about it than I did because she communicates with Richard frequently. So I don't know, Trina, if I bounce that to you.
Yeah, I think I know we have Dr. O'Dowdy's most recent webinar on our website. That might be the best place to go and review that. And that was as current as up to date at that point. But I think we're almost done collecting samples in United States.
Great.
All right, the next one. In relation to prophylactic use of TXA in Greyhounds, what do you think of giving IV TXA on the day of surgery as the bleeding is delayed? Is it preferred to give just oral following surgery? And also, is the dose 10 mg per kg sufficient?
Yeah, I tell you, as I was saying before, I do not have a lot of first-hand experience with tranexamic acid, but 10 to 15 megs per kilo is the recommended dose. You have to be really careful because if you give TXA IV, and if you give anything over 10 megs per kilo, the dose will immediately vomit. Actually, a TXA is used in pharmaceutical companies that are trying to develop drugs that are anti-nausea. How do they make dogs vomit? They give them TXA IV. So I all the studies we did. So remember, this bleeding is usually delayed, so it does not start at the time of the surgery. It's extremely unlikely for a greyhound to bleed during surgery, but because they start later. The study, the way we did the prospective spay and neuter study was, so let's say the dog gets spayed this morning. When they are ready to drink water at the end of the day and to eat at the end of the day, that's when we start giving them the drug. All right. If they got spayed in the afternoon, then we start the drug the following morning. The way things have evolved is I strongly believe that TXA or aminocaproic acid are a little bit of a security blanket now. So a lot of people are starting the dogs on the drug either the day of the surgery or the day before the surgery. And I've gotten even some consult where the vets go, well, we have been putting them on aminocaproic acid for 5 days before the surgery and then 5 days after. So the way we have used it is 5 days, giving it starting the day of the surgery or the day after the surgery. That's what I have the data for.
Okay. I'm eager to hear it all, but we are recovering from a ruptured disc and full paralysis, which I was told is unusual for large dogs and grays. I'm interested to know if there is something we have done wrong, like jumping in and out of the car or onto the bed, or what else we should have considered.
Yeah, good question. Well, I tell you, as the dad of a greyhound with multiple disc prolapses, Clyde, my first greyhound, actually had three disc prolapses, two in the neck and one in the thoracic vertebra. I have seen quite a few greyhounds with disc prolapses, which is an issue because the surgery may lead to bleeding, and then you end up having a compressive lesion from the bleeding after your patient recover from the surgery. But I don't think there's anything that you did or that he did. I think that quite likely, like in other breeds of dogs, there is a genetic component to, disc degeneration and prolapse. But I've seen quite a few, and it's interesting because I don't read orthopedic surgery books, but the older orthopedic surgery books would state that sighthounds rarely have disc prolapses. I've seen, I'm not going to tell you I've seen hundreds, but I've probably seen, I don't know, maybe 15, 20 greyhounds with disc prolapses over the years. So it's there.
Okay. Is Librella safe for greyhounds?
The answer is it may, but you guys know that there is a lot of stuff going on about all these biological treatments and, delayed adverse effects. So I assume they are, you know what I mean? I don't think greyhounds are any different when it comes to a biological than other breeds of dogs. I'm always more concerned about drugs, particularly the ones that need to be metabolized in the liver, because the greyhound liver metabolizes drugs totally different than most every other dog's liver. So I think it's probably a safe drug. I know of greyhounds who have been on Librela, but I don't, I usually you hear only the bad things, right? So if you're doing consultations, you will hear, "Oh, my dog got Librela and got sick." I have never gotten one of those consults so far.
Okay. I'm interested in hearing about any particular sensitivities for galgos and NSAIDs or other arthritis type medication.
Yeah, Italo, I think that I can show you pictures of GI perforations with every single NSAID that has ever been done in any breed of dog that you can look at. So I think that they are no different than any other dogs. And, they are dogs that will take, therapeutic doses of NSAIDs and they will get severe adverse effects. I don't, my experience, at school, we had lots of dogs with injuries that were on NSAIDs. I don't remember ever having seen a perforation in a galgo for that was on NSAIDs. But I mean, that can happen in any breed of dog with any NSAID, any brand of NSAID, any type of NSAID. So the key is you have to monitor dogs that are on NSAIDs. And
All
by
right.
the way, that's non-steroidal anti-inflammatory drugs for people who don't know.
This one may be one you'll have to talk afterwards, but they ask, I have an 8-year-old female from Spain. We thought she had kidney failure, but found she had Lyme disease. She's doing much better, but still having trouble getting her to regain muscle mass. Any suggestions would be appreciated.
Yeah, again, the question would be, remember that does she have only a positive SNAP test for Lyme disease? Did they titrate the antibodies? Did they do this what we call C6 quant? That is the one that tells you, whether this is active infection or prior exposure. But you folks will have in my first slide the email address, and you can email me through the GHI website. So if I can help with that, I will likely need to look at, lab work and images and a number of other things.
All right, the next one, my Greyhound seems to have intractable diarrhea. Any advice about food or supplements?
No, I tell you, most greyhounds will get diarrhea, and I am totally convinced that greyhounds do have irritable bowel syndrome, the same thing that people have. A lot of the veterinary gastroenterologists say that irritable bowel doesn't exist in the dog. I can show you lots of cases that a greyhound comes into the clinic, they poop outside, they have the most beautiful poop you've ever seen. You put them in the kennel, and you go back 15 minutes later, and there is bloody mucousy diarrhea all over the crate, and that is the only likely mechanism is that. But as I said before, when we have a dog with diarrhea, the first thing we veterinarians like to do is to decide, is it due to a small bowel problem or due to a large bowel problem? And that, how do we decide that? We look at how often they do it, what does the stool look like, what is the volume of the stool, et cetera, et cetera. And we manage, small bowel diarrhea very different than we manage large bowel diarrhea. But in greyhounds, I think that we see what, for lack of a better term, I call fiber responsive colitis. So they have large bowel diarrhea, they poop several times a day, it's cow patty, it has mucus, sometimes it has blood. And you put them on things like Metamucil or some other, Zillium supplement, and within 2 or 3 days, the diarrhea goes away. So again, if you look at mechanisms of diarrhea and causes of diarrhea, in dogs, there are tables that are 2 pages long. So, I will need to have a little bit more info in order to hopefully be helpful.
All right. And the next one, thoughts on limb salvage versus amputation for osteosarcoma and when either is a viable option.
Yeah, good question. We'll talk more about that when we talk about osteo. Personally, I would not put my own dog through limb sparing surgery, having dealt with lots and lots of patients. I think the quality of life is significantly better under amputation. The patient is pain-free forever. You don't have to worry about secondary infections. Most dogs that undergo limb sparing surgery, we're talking about distal radius. The lower radius is the only one that you can safely limb spare in a greyhound or in other big dogs. But personally, I am more interested in quality of life than in cosmetics. And I always used to tell the students that greyhounds come out of a factory with 3 legs and a spare one, so they never need that fourth leg. So to me, as a medical oncologist, not a surgical oncologist, I do not recommend it. I discuss it with the families, of course, but it's not my decision. It's the family's decision. But I would not put my own dog through a limb sparing surgery. You have to deal with it until either you amputate the leg, that happens in about 1 out of 3 dogs, or your dog is euthanized due to something else. So it's not, surgery and done. This is a process that, most get infected. It's just, to me, it's just not fair to my patients.
All right. Could you please comment on operative and post-operative management of greyhounds who are homozygotes for the depot gene?
I don't know of any data on greyhounds and bleeding and the genetics of deepen. So I know that Michael is working on that, but I am not aware of, I point blank asked Michael, so do you think that if you get a quote unquote negative test, the dog is not going to bleed? He goes, well, I'm not ready to say that yet. So I think that those were the exact words he used. But as of now, I'm sure that there will be data coming out because in that paper he looked at 649 greyhounds. So I'm sure that I know he was collecting data on the bleeding. But as of now, the only thing I can tell you, the official line from Washington State is it has been validated only in deerhounds.
Okay. We've had two greyhounds that have had masses on their spleen that have ruptured. Is this a common greyhound issue? And are you aware of any causes of this or preventative measures?
Ah. That is not common, to be honest. It's really interesting because I always used to tell the students, greyhounds have big spleens. When they have splenic pathology, they usually get a diffusely enlarged spleen as opposed to a mass. We see splenic masses, in dogs on and off, but they are not as common as, say, in a golden or a lab or a Rottie. So, and remember, splenic masses can rupture even if they are benign. So, a rupture of a splenic mass doesn't necessarily indicate that it is malignant. So, what do we do in those dogs when we do ultrasound and we see a mass in the spleen? We just put a needle through the skin and look at it under a microscope.
Will AKC and racing greyhounds have significant differences in typical blood work ranges?
No, I tell you, the answer is I don't know, but we wanted to do a reference interval study with AKC Greyhounds, and we ran into several logistical issues. So we ended up collecting very, very few dogs. But so I cannot tell you. And in the clinic at OSU, we probably the ratio of retired racers to AKC Greyhounds that we saw was about 100 to 1. So we saw very, very few AKC Greyhounds.
Are there meds which should not be administered together at the risk of causing viscous blood?
Drugs that should not be administered together.
Mm-hmm.
Well, again, it depends. There's a lot of drugs that have negative interactions, in dogs and in people. So I don't know if that refers to a specific question, but there's always, anytime you're going to combine drugs in a dog, you need to look at a drug interaction checker, and there's plenty of those online. So
All right. What is the risk of a post-operative hemorrhage in non-greyhound sighthounds, even with homozygous positive depot, i.e., are there breed differences in clinical manifestations?
yeah, I tell you, if you remember that slide I show you from Michael's work, there are some sighthound breeds that do not have that depot gene mutation, that's SERPINF2 gene mutation. And interestingly enough, some of those breeds are breeds that I have received consults about postoperative bleeding. So I think that other than, we had a meeting with the Whippet medical group maybe like 3 weeks ago. And after this paper came out that 8% of whippets had the gene mutation, then they were trying to do a study. And I was telling the vet who's in charge of one of my former students that, first we need to know if whippets actually bleed. And there is anecdotal evidence that some of them will bleed, but we're trying to organize a survey to see, how many whippets actually bleed. But I have to tell you that I have gotten consults on post-op bleeding in probably most every sighthound breed. Sporadic, all right, not like as many as I get in greyhounds, but I think that greyhounds, deerhounds, wolfhounds, and Italian greyhounds are probably the four biggie ones that I gotten consults on.
What would cause bleeding and excessive bruising, which is spontaneous rather than trauma related?
Probably the same thing. I tell you, one of my greyhounds, Raider, he would go running. We used to live in the country, and he would come back all bruised. And we worked him up to a till. This is before we knew enough about this post-op bleeding, and we see a lot of absolutely normal greyhounds that will exercise and bleed. And I think, as I was saying before, it's likely that enhanced clot busting system that is trying to keep that blood from clotting while these guys are running and this blood is so viscous.
All right. thoughts on the more prevalent usage of gabapentin for pain management?
Yeah, again, it all depends what kind of pain you're managing and what other drugs you're using. And there is a drug that is called tramadol, not trazodone, but tramadol. That is basically a morphine-like drug that was really widely used several years ago. And then these two papers came out, and then several papers came out after that saying that it is indeed not a very good analgesic in dogs. My experience for bone pain, we have osteosarcoma greyhounds where amputation is not an option. Uh, Tramadol works very, very well, provided you use it at lower doses. If you use high doses, remember, greyhounds don't metabolize narcotics very well. So they act, they whine and they stare up in space and they stand in a corner, and you sense that that is actually pain, but that is actually an adverse effect of the drug. So I like tramadol for bone pain, but visceral pain is different, superficial pain is different. So that could be a 1 hour lecture on how to manage pain, and I wouldn't be the guy to do it probably.
All right. My vet in Tucson pre-treats most greyhound surgery and dental patients with Amicar. It's appropriate for one of my hounds because she exhibits post-surgical bruising, but is it appropriate for all greyhound patients?
Yeah, I tell you, if we had the crystal ball and we would know which one was going to bleed, obviously that would be really easy, but we don't have either a test or a crystal ball quite yet. So my approach is as follows. If my own greyhound had to have a superficial surgery, I would not put him on preemptive aminocaproic acid, but I would have aminocaproic tablets with me in case he or she starts bleeding. And we do that a lot with dentals. You're going to do an extraction. Do you need to put them on aminocaproic acid preemptively? I can tell you that I have seen dogs that bled and require 5 blood transfusions from one tooth extraction. I have seen greyhounds that had a 4 millimeter skin biopsy punch biopsy, 4 millimeter. All right, so a fifth of an inch, give or take, and they had to be transfused. So those are the exceptions. However, if I have what I call big surgery, abdomen, thorax, limb amputation, cancer surgery, I think that I would preemptively use Amicar. Have I ever seen a dog that was placed on Amicar and threw a clot after surgery? Yes, one. A dog in Canada that ended up having to have his leg amputated because he threw a clot to a front leg, and basically there was nothing else they could do about it. But that's an N of one out of thousands of dogs that received Amicar. And remember, the dose of Amicar we use is extremely low. 10 to 15 milligrams per kilo is very, very low. In people, they use 5 to 10 times that dose. So I think that that also plays a role. So I think that oftentimes we will send a greyhound home with 5 days worth of Amicar tablets. I will tell the owner, monitor the site. If they start bleeding, start right away. Usually when you give it orally, it kicks in within 2 hours. So it's a pretty effective, rapidly absorbed drug.
All right, so a couple of questions that are kind of similar to what that one was, and I'll see if you have anything additional to add. One is, if a greyhound goes through a neuter without issue, does that mean that they're going to be okay in all follow-up surgeries?
Yeah, that's a great question. And I tell you, we have seen dogs that bled severely during spay or neuter. They came back several years later and they had cancer surgery and they didn't bleed. And we look at each other and we go, huh? What was that about? But I think that if you have a dog that had a surgical procedure and they do not bleed, is probably an indication that they do not have the gene mutation that causes the bleeding. However, remember, life is a bell-shaped curve, all right? There's 2.5% of dogs on either end of the curve who will act different than the other 95% of dogs.
And then on the other side of the same equation is someone has a 12-year-old greyhound who would benefit from a dental cleaning, but he is a known bleeder. He responds well to aminocaproic acid, but I'm hesitant to do the cleaning. What would be your thoughts?
Yeah, I tell you again, it depends, about how bad the mouth is. But I don't think that the risk of a severe bleed in a dog that is a known bleeder that will get a dental but will receive aminocaproic acid is extremely high. Could they bleed? Yes, but I think the probability is that he will benefit more from the dental than I would worry about the complications of the surgical procedure.
Okay. How does a greyhound's intrinsic physiological adaptations for speed, such as the higher blood volume and hematocrit than the average canine, as well as more efficient blood oxygenation, compare to the physiological adaptations of high altitude human populations?
There are similars, really good question. There are similarities and there are differences. When Sarah and Lily and Christine and I were looking at hemoglobin in greyhounds, we did a lot of studies looking at the blood pigment at hemoglobin and see how it carries oxygen, how it releases oxygen. We work with a group at Ohio State in clinical chemistry, actually chemical engineering, that basically all they do is they study hemoglobin. So we were reading a lot of papers on high altitude adaptation, and there are similarities and there are differences. So that I'll take. It would be something better chatted about over a couple of beers or something like that.
And then somebody said it may not be covered in today's session, but I have a male neutered greyhound with chronic UTIs. We sent the cultures out and the bacteria should respond to the antibiotics he's given, but it keeps recurring. Have you ever seen anything like this? My vet is stumped.
Yeah, I tell you, that's pretty uncommon. Recurrent UTIs in male dogs are uncommon. Recurrent UTIs in male greyhounds are even less common. So more often than not, when you have a recurrent UTI in a male neuter dog, you have anatomical abnormalities, either a bladder diverticulum or you have chronic prostatitis or something like that. So I don't know if they went that route, but an ultrasound will probably be a next good step. And the other important thing is it always the same bug or are they different bugs? Do they always have the same antibiotic sensitivity or not? Is it a reinfection or a recrudescence? So, again, lots of things to look at, but I would look for anatomical abnormalities.
All right. I'm interested in future session to have information on cups. My 12-year-old has this, and I'm wondering what other forms of care there are than a dental every 6 months or a total mouth extraction.
Yeah, I don't think we know, to be honest. I am not aware of any good studies. I talked to veterinary dentists on and off about greyhound teeth, but we see a lot of greyhounds, and you know how the dentists like to change the names of these things every few years so that they keep everybody on their toes. But, in the old days, we used to see this, what we call chronic lymphoplasmacytic gingivitis, and we still see a lot of greyhounds, and when we biopsy them, they have a lot of leukocytes, white blood cells infiltrating the gums, and it's likely an autoimmune or immune mediated disease. And in a lot of these greyhounds, I use immunosuppressive drugs, and they do really, really well. What is the catch? Most of the immunosuppressive drugs that work in dogs, in my experience, do not work in greyhounds. So I use a different. I use a drug that's called chlorambucil that works very, very well for immunosuppression in greyhounds. It's all, I always say greyhounds are a hybrid between a dog, a cat, a llama, and a number of other animals. And chlorambucil is a really good immunosuppressant in cats. So I have very good results with immune diseases if that's what he had. So I don't know if they biopsied the gums, but that will probably be the best next step if it wasn't done.
All right, and then we have a couple about heartworm preventative. What's the best heartworm preventative for seizures as well as flea and tick prevention? And
Yeah,
how
I don't.
common is it?
I would tell you, in my experience, most of them seem to be the same. So I don't think there is any greyhound related issue with any of them.
Okay. My 11 and a half year old greyhound was in kidney failure and suddenly developed severe rear leg weakness. Walked like a drunken soldier. I thought it was a stroke, but the vet didn't think so. What do you think?
Yeah, well, I tell you again, as I said, it depends. But if they, first of all, chronic kidney disease is very uncommon in greyhounds. We will see it on and off, but most of the greyhounds they have CKD or chronic kidney disease is secondary to this protein losing nephropathy that I'm going to talk about in the next session. And most dogs with protein losing nephropathy, so that means they are spilling protein in the urine, most of these dogs will have a significantly enhanced clotting system. So they are what we call hypercoagulable. So protein losing nephropathy is one of the highest risk factors for thrombosis, for throwing clots. So that's quite likely the case.
All right, I think we have time for one more question, and I'm going to kind of combine a couple because a lot of people are asking
Yep.
about the use of aspirin for strokes, and then how that would impact depot as well if they gave aspirin for the stroke.
Yeah, I don't think I have had quite a few dogs that were quote unquote bleeders that had thrombosis and I had to put them on aspirin, and I've never noticed any difference in the bleeding, was it worse or not with or without the aspirin. The dose we're using is really, really low, and so low that we can, if you have a dog that is taking prednisone for something else or a dog that is taking an NSAID for something else, it does not seem to really cause any problems if you add the aspirin. But I personally have never noticed any, if you may, increase risk of bleeding if they are taking aspirin. We had, hundreds of greyhounds that are on aspirin for life, because they threw a clot when they were a year and a half old and then were afraid to take them off the aspirin. So in my experience, it doesn't seem to be an issue.
Okay, Mandy, you want to take over?
Yes. Can everybody hear me okay?
Yes.
Okay. Thank you everyone for coming. We really appreciate your support, and we are so grateful to Dr. Couto for putting on this webinar today. We will keep you posted about a second session this summer. Our website is the best place for you to keep up to date on everything. It goes there first. But we're also on social media, so you can check us out there. If anyone is interested, we are looking for more volunteers for the Greyhound Health Initiative. We're mainly volunteer based, and you can kind of look at our website for specific jobs that we're looking for, but also if you are just passionate about greyhounds and you want to try and help out, send us a message and we'll see if there's a place where you can fit in. We're very busy here, and we are excited to bring everybody the most recent information on your sight hounds. So our website is ghi.vet, and thank you so much for coming again.
Thank you, Mandy, for having me, and hopefully you guys learn a couple of new tricks, and we'll see you in the next one.
All right, thanks.
Bye.
Bye.